Characteristics of newborns. Size. The average newborn in the United States weighs about 7.5 pounds and is about 20 inches in length. For the first few days of life, infants typically lose about 5% of their body weight as they eliminate waste and get used to feeding. This often goes unnoticed by most parents, but can be cause for concern for those who have a smaller infant. This weight loss is temporary, however, and is followed by a rapid period of growth. Characteristics of newborns. Brain development. Some of the most dramatic physical change that occurs during this period is in the brain. At birth, the brain is about 25% its adult weight, and this is not true for any other part of the body. While most of the brain's 100 to 200 billion neurons are present at birth, they are not fully mature. During the next several years, dendrites, or connections between neurons, will undergo a period of transient exuberance or temporary dramatic growth. Characteristics of newborns. Body proportions. The head initially makes up about 50% of our entire length when we are developing in the womb. At birth, the head makes up about 25% of our length. Think about how much of your length would be head if the proportions were still the same. Characteristics of newborns. Appearance at birth. During labor and birth, the infant's skull changes shape to fit through the birth canal, sometimes causing the child to be born with a misshapen or elongated head. It will usually return to normal on its own within a few days or weeks. Some newborns have a fine, downy body hair called lanugo. It may be particularly noticeable on the back, shoulders, forehead, ears, and face of premature infants. Lanugo disappears within a few weeks. Likewise, not all infants are born with lush heads of hair. Some may be nearly bald, while others may have very fine, almost invisible hair. Some babies are even born with a full head of hair. Amongst fair-skinned parents, this fine hair may be blonde, even if the parents are not. Immediately after birth, a newborn's skin is often grayish to dusky blue in color. As soon as a newborn begins to breathe, usually within a minute or two, the skin's color returns to its normal tone. Newborns are wet, covered in streaks of blood, and coated with a white substance known as vernix, which is thought to act as an antibacterial barrier. The scalp may also be temporarily bruised or swollen, especially in hairless newborns, and the area around the eyes may be puffy. The newborn may also have Mongolian spots, blue or blue-black birthmark on the lower back, various other birthmarks, or peeling skin, particularly on the wrists, hands, ankles, and feet. A newborn's genitals are enlarged and reddened, with male infants having unusually large scrotum. The breasts may also be enlarged, even in male infants. This is caused by naturally occurring maternal hormones and is a temporary condition. The umbilical cord of a newborn is bluish-white in color. After birth, the umbilical cord is normally cut, leaving a 1 to 2 inch stub. The umbilical stub will dry out, shrivel, darken, and spontaneously fall off within about 3 weeks. Occasionally, hospitals may apply triple dye to the umbilical stub to prevent infection, which may temporarily color the stub and surrounding skin purple. Newborns lose many of the previously mentioned physical characteristics quickly. Thus, older babies look very different. While older babies are considered cute, newborns can be quote-unquote unattractive by the same criteria, and first-time parents may need to be educated in this regard. Characteristics of newborns. Sleep. A newborn typically sleeps approximately 16.5 hours per 24-hour period. The infant sleeps in several periods throughout the day and night, which means they wake often throughout the day and night. Characteristics of newborns. Reflexes. Newborns are equipped with a number of reflexes, which are involuntary movements in response to stimulation. Some of the more common reflexes, such as the sucking reflex and rooting reflex, are important to feeding. The grasping and stepping reflexes are eventually replaced by more voluntary behaviors. Within the first few months of life, these reflexes disappear, while other reflexes such as the eye blink, swallowing, sneezing, gagging, and withdrawal reflex stay with us as they continue to serve important functions.